Welcome to the Unit 7 presentation on cardiac function. These are your learning objectives for circulation. Please familiarize yourselves with them and be able to answer them in preparation for class and the exam. Alright, this video is of circulation through the heart and body, and I will make this available on E360 in a different section. So Objective 9 asks you to review how blood circulates through the body. Oxygen is carried via the hemoglobin in the blood to the peripherals, and then the oxygen-depleted blood is carried back to the heart by the superior and inferior vena cava. The depleted blood gets carried through the right side of the heart to the lungs for reoxygenation. The now oxygen-rich blood is then carried back to the left side of the heart and pumped out to the peripherals again, and then the cycle repeats itself. The cardiac output is simply the amount of blood pumped by the heart per minute. So the cardiac output is the product of heart rate, which is the number of beats per minute, and the stroke volume, which is the amount of blood pumped per beat. So cardiac output equals heart rate times stroke volume. And the cardiac output is usually expressed in liters per minute, and the heart moves about 3.5 to 8 liters of blood per minute. Objective 11 is to identify factors affecting circulation across the lifespan. Some factors are modifiable and others are not. Modifiable risk factors include smoking, nutrition, sedentary lifestyle, obesity, and stress. And then non-modifiable risk factors are family history, gender, personality types. So then Objective 13 is to describe assessment findings associated with circulation problems. This can be seen with changes in vital signs like blood pressure less than 90. This is a serious sign of decreased cardiac output. With pulse rate and character, a diminished or absent peripheral pulse is a sign of decreased perfusion. Changes in skin include color, hair loss, thickened toenails. Decreased cardiac output can be from an MI, valve dysfunction, dysrhythmias, altered blood flow, then also is seen with dehydration or excessive fluid volume, atherosclerosis, and venous pooling. Decreased tissue perfusion is seen with tissue ischemia, like peripheral artery disease and thrombus or DVT. Objective 10 asks you to explain how cardiovascular conditions can lead to decreased circulation. So examples of this are abnormal heart rhythms and CHF, or congestive heart failure. So as we begin our assessment, we look at risk identification, such as previous cardiac events or issues, like coronary artery bypass grafting, MI or heart attack, or stent placement, and deficits from them. We look at modifiable risk factors, which can result in lifestyle changes for the patient. Their dietary intake, specifically saturated fats, cholesterol, sodium. You want to remember, have your patient describe their normal daily intake. Just don't ask them, is your diet okay? You want to actually have them recall what they have. We also assess activity and exercise patterns, prescription or over-the-counter meds, and illicit drugs. And this is an important one because patients can experience an MI from coronary spasming, which comes from cocaine use. So what happens is your patient comes in with a ST elevation MI, but then when they go to the cath lab to get their vessels looked at, their coronary arteries are clear. So the damage is not caused from plaque buildup like in a regular heart attack situation, but it's actually caused from the coronary spasms, which result from the cocaine use. You're going to inspect them. How do they look? Altered cognition is an indicator of decreased perfusion, so keep that in mind. Do they have edema, central cyanosis, peripheral cyanosis, diaphoresis, changes in hair distribution on their lower extremities or arms, or is there neck vein distension, which signifies fluid overload? Palpate them. Are they warm, dry, cool, clammy? What's their pulse quality and rate? Are they regular with their heart rhythm? If they have an irregular rhythm, you want to make sure you check apical and peripheral pulses at the same time, because what this does is it tells you if all of their beats are being perfused or if some of their beats are like premature ventricular contractions or something that doesn't perfuse and doesn't do them any good. Check their daily weight to assess fluid retention, and then check capillary refill. And then finally, we're going to auscultate or listen. We're going to check their blood pressure, their apical pulse, heart tones. Normal findings are S1, S2. Abnormal findings would be murmurs, rubs, or gallops. And then think about what lab tests are predictors of heart problems. We check a CK, a CKMB, and a troponin when people come in with chest pain. And troponins are proteins released from cells when tissue breakdown occurs. So you get elevated troponin in heart ischemia, but it can also be elevated in dialysis patients. So it's not a total hard and fast indicator of a heart attack. The proBNP increases when heart muscle is overstretched and can indicate fluid overload, although not always, but pretty consistently. An electrolyte panel looks for sodium, calcium, mag, and potassium imbalances. And you check the CBC, and what you're looking for here is hemoglobin and hematocrit, because oxygen's carried through the body on the hemoglobin. And so if that's low, you're going to have oxygenation issues too, likely. Other diagnostics include an EKG, an echo, chest x-ray, stress test, or angiogram. This slide lists different nursing diagnoses, interventions, and outcomes, so you can kind of take a look at that, and then ask yourself what the NOC and the NIC stand for, as noted on this slide. And NIC is Nursing Interventions Classification, and then NOC is Nursing Outcomes Classification. And remember from last week we said the nursing interventions, you know, if the nurse will put in front of it makes sense, then it's an intervention, and the outcome would be if you can put the patient will in front of it and it makes sense, then you know it's classified as an outcome. So this slide lists some possible goals. So for example, the patient will maintain adequate cardiac output. You would want to add to it and make it a SMART goal. So you'd put maybe the patient will maintain adequate cardiac output throughout hospitalization or by discharge or something to that effect, just to make it more measurable. And we next implement our nursing interventions, and this slide lists some interventions that you can do for health promotion. Other important interventions have to do with teaching, and teaching for cardiac function disturbances is pretty important for your patient, because you want to make sure your patient knows when they need to call for help. They need to understand why and what medicines they're taking and what they can do if they're at home and they have chest pain. So what do we do for chest pain? Chest pain is treated using the acronym MONA, M-O-N-A. So that stands for morphine, oxygen, nitro, and aspirin. So morphine and nitroglycerin are important because they dilate the coronary vessels and also the periphery. So it not only allows more blood-rich oxygen to get to the heart easier by the coronary arteries, so the heart's better perfused, but it also dilates the periphery, so your afterload is reduced, so the heart doesn't have to pump as hard to get the blood out to the rest of the body. So it increases the oxygen that gets to the heart and decreases the workload of the heart. And then oxygen increases the oxygen supply to the heart, and aspirin's important because it helps to prevent platelets from sticking together and worsening blockages if the problem is a blockage. Edema reduction measures include elevation, sodium reduction, fluid restriction, and then compression, like with TED hose and compression stockings. And finally, we evaluate the nursing care plan and we modify it as needed. So we're asking, were the goals met? Were they not met? Were they partially met? So if they're met, you can cross off the care plan and mark it as completed for that problem. If they're not met or they're partially met, we need to look at, do we need to revise and revamp the plan of care and go from there. So these abnormal findings require an immediate follow-up because they signify the patient's deteriorating or will be deteriorating soon. This is what we were kind of talking about last week with the failure to rescue. You want to make sure you jump on these things out of the gate so that you don't have your patient with these symptoms of deterioration that we miss, and then they get into a worse situation and possibly even a code blue situation. And the basis, a problem is much easier to prevent than treat once the patient's going south. So you want to do a quick follow-up, and interventions may save lives. So just keep that in mind. And this concludes the presentation on circulation. Please be sure to view the oxygenation presentation before class as well. Thanks, and have a great day.